Thank you for being a preceptor for one of our nursing students. By agreeing to precept a student, you are taking on an important and vital role in the education of a student nurse to provide a strong stepping stone for their future. Our School of Nursing wants to provide you with support in the preceptorship role to create a positive and productive educational journey for both you and the student. As a preceptor, it is important to note what your role entails. Preceptors are experienced professionals, employees, and individuals who facilitate a nursing student's learning and contributions within a professional setting. Preceptors are paired with a student for a specific time period in order to assist and support learning experiences and orient the student to the practice placement. The School of Nursing emphasizes a triad model for students in a preceptored experience. The triad model involves a student, the preceptor, and the student's faculty advisor to communicate and work together to achieve the student's objective of meeting the course requirements as identified in the course syllabus. In partnership with your hospital and the School of Nursing, you will play an integral role in the education of the student nurse. We hope that this experience will not only benefit the student, but contribute to your own professional growth and development as well. One previous preceptor from a rural hospital said,
"I would do it again. I thoroughly enjoyed my experience. She was a joy to work with and challenged my own knowledge and learning."
The College of Nurses recognizes the importance of your contribution to the profession of nursing and also supports your participation in the education of nursing students. As mentioned before, a preceptor plays a central role in the student's education, which comes with many responsibilities, such as providing an orientation to the practice setting. The student may have some additional need to be introduced to the community since they will be living and working in a new environment away from family and friends. Although the student will be connecting with their peers and faculty advisor through teleconference or OTN video conference, there may be some feelings of isolation, so the student may need some assistance to adjust to their new community. One previous rural place nursing student mentioned the importance of having a home away from home.
Self-direction and independence were fostered with the encouragement of supportive preceptors and colleagues. I was able to experience the calm and beauty of small-town Ontario.
Negotiating mutual role expectations of both yourself and the student. Your student will also have responsibility to keep up with their coursework, as it is important for the student to have the necessary resources and time to complete this work. Negotiating work schedules is essential to achieve this, and discussing mutual expectations and roles is encouraged. Assisting the student to tailor their learning plan. During placement, the student will be working on a learning plan with consultation of you as the preceptor and with the student faculty advisor to ensure an instructive placement experience. Collaborating with the student's faculty advisor. We encourage regular and frequent dialogue with your student's faculty advisor to provide updates on the progress of your student. This can be done via telephone, email, or video conferencing through OTN. Sharing verbal and written feedback with both the student and the faculty advisor. Evaluation of the learning experience and progress is essential for both you and the student. Your feedback is important to your student throughout the placement experience, and assessment of the student's progress guides the student and faculty as they assess the student's successful completion of the program. Giving and receiving feedback is often challenging, so feel free to contact the faculty advisor for help or visit the website provided for some guidelines. Remember, the preceptor is only asked to provide feedback on the student's learning plan and is not responsible for marking student assignments and assigning the final pass-fail grade. Reporting concern about unsafe nursing practice. We are confident that all will go well with placement, but if there are any concerns about the safety of the student, we urge you to initiate contact with the faculty advisor and the student immediately. Assisting the student to access resources and relevant learning opportunities. Our previous rural place students have described wonderful opportunities as they experience working with a diverse interprofessional team. One student said,
"I was exposed to great diversity of clinical problems which might not have been available to me had I been assigned to a specialist floor in an urban setting, and I was called in when there were interesting cases."
Mentoring the student to help increase their competence and confidence. The preceptorship model for nursing education has long been recognized as a vital part of nursing education. As your student works beside you, you will serve as a professional role model while you assist your student in their transition from student nurse into the professional role. With all these key responsibilities, we would like to thank you again for taking on the role of preceptor to educate and help a student in their nursing career. Nurses working in rural settings are generalist experts with the ability to adapt to various practice areas with an absolute wealth of knowledge to share. We value your experience and knowledge in the rural nursing field, and we wish both you and your nursing student an enriching and collegial experience.